Hello, how are you? I'm Nicole. I'm going to be your nursing student today. I'm a nurse, but I'm getting my bachelor's right now at Nevada State College. And I'm just going to be doing a head-to-toe assessment on you. Is that okay?
Yes.
Okay, I'm going to start off by asking you some questions about yourself. What's your name?
Danielle.
Okay, and what's your date of birth?
11/12/86.
And do you have any current health issues?
No.
Have you ever had any surgeries or traumas?
No.
Do you take any medications?
No.
Do you have any allergies?
No.
Okay. Have you had any issues with nutrition lately? Any loss of appetite, weight loss, or weight gain? Okay. And do you do any exercise?
I do.
What do you do for exercise?
Running 3 to 4 times a week.
Okay, that's great. Do you drink or smoke alcohol at all?
Just social drinking.
Okay, that's okay. And then I'm just going to ask you some more questions, and we're going to move on to the physical part of the assessment. Do you know who the President of the United States is right now?
Barack Obama.
Okay, good. I know. Some of the questions are silly, but I have to ask them. Do you know how old you are? What's your age?
27.
Okay. And we're going to also move on to the physical part of the assessment. You're alert and oriented. You know the time, the president. So that's all good things. And I know it seems silly, but we have to assess them. And so I'm going to move on to the physical part of the assessment. I'm just going to start at the top and work my way down, okay? Okay, so we're going to start with your face. Your eyes are symmetrical bilaterally. Your hair is distributed evenly throughout your eyebrows and eyelashes. I'm just going to be feeling around and feeling your head. Your skull is smooth and soft upon palpation. No mass is noted. No lesions. Your hair is distributed evenly and smooth. I'm just going to assess your temporal mandibular joint. Do you have any pain right now?
No.
Okay, can you open your mouth? Do you have any pain with that?
No.
Perfect. No pain with palpation. I'm going to further assess your eyes. Your conjunctiva are pink and clear. Your irises are blue, and coloration is throughout. No redness or drainage noted in the eyes. I'm just going to palpate your lacrimal duct. Okay. Any pain with that? No? Perfect. No discharge noted with palpation. I'm just going to inspect your ears. Feel them. Okay. No masses or lesions noted. Bilaterally, ears are symmetrical and even. Just going to look inside your ear. Ear canal appears smooth and pink. Do you have any issues with hearing?
No.
Okay, perfect. I'm going to move on to your nose. I'm going to just close this side of your nostril and then the other side of your nostril, and you're just going to breathe out for me, okay? Perfect. Both nares are patent. The nose is symmetrical, even, no pain. We're going to test your sense of smell and your cranial nerve, your first cranial nerve. So I'm going to have you close your eyes, and I'm going to put 2 scents by your nose, and you're going to tell me what they are, okay? Okay. So, close your eyes. Okay. And the first scent.
Coffee.
Perfect. And then I'm going to give you one more scent. Okay. And again. Perfect. Your first cranial nerve is intact. I'm going to also move on and assess your pupils. It's my light. You're just going to look straight at me. Okay. And again. And you're going to close your eyes. And open them again. Pupils are 3 and brisk and equal and reactive to light. And we're going to check the accommodation of your pupils. I'm just going to have you open this. One of them. And have you just follow the Q-tip. Perfect. Good. Okay. So pupils are 3 and brisk. We said that. Okay. And we're also going to be checking your mouth now. Your lips are pink and non-cracked. They're moist. We're going to move on to the inner side of your mouth. Okay. You can stick out your tongue and put it straight. Your tongue appears to have no lesions and is pink and moist. We're going to check your buccal mucosa on both sides. Both appear to be pink with no lesions or redness. The hard palate is smooth and white bilaterally throughout. The soft palate is pink and moist bilaterally. I'm just going to have you stick out your tongue and say The uvula is midline and perfect. Is midline and elevates. That lets me know your 9th and 10th cranial nerves are intact. I'm going to have you also now puff your cheeks and blow it out. Smile. Crinkle your nose and your forehead. Okay, and that lets me know your 7th cranial nerve is intact. And then I'm just going to also open your mouth one more time and inspect your tonsils. Okay, the tonsils are +2 and no exudate noted. They're pink. Perfect. Okay. We're going to move on to testing your, your neck and head. We're going to be testing, actually I'm going to move on to your neck. Can you shrug your shoulders? Perfect. And your shoulder strength is equal bilaterally. And we're going to palpate your neck. I'm just going to go behind you now. I'm just going to palpate your trachea. Trachea is midline, and the thyroid is non-palpable, which is a good thing. And I'm going to be testing your lymph nodes now. Okay. I'm going to be testing your pre and post auricular, here, and your occipital. Okay. And your jugulodigastric. Perfect. And your submandibular, submental, and your superficial posterior deep cranial nerves. Superficial, posterior. Your deep. Can I have you go just shrug your shoulders forward? Deep cervical and supraclavicular. Sorry. Okay. All your lymph nodes are non-palpable. Good. Just fix this computer. Okay, perfect. And now I'm going to assess your jugular for bruits. So I'm just going to have to lift the auscultate on both sides of your carotid artery. Okay. Let's take a deep breath. Perfect. And another deep breath. Okay. One more. Perfect. No bruits noted on auscultation. Okay, so we have inspected your head and your face, your cranial nerves, your eyes. We have tested your lymph nodes, your neck, and we're going to move on to your cardiovascular system. So I'm going to be listening to your heart in different places and seeing your perfusion and making sure that's all okay, okay? Okay. So I'm going to inspect your chest wall. Okay. Just going to have to pull your shirt a little. No pulsations noted. The chest is symmetrical bilaterally. No masses noted. And I'm just going to listen. Okay. So listen to your apical pulse. And I'm going to look at the clock. Perfect. Your apical heart rate is 62. Now I'm going to move on to listening to different areas in your heart where different valves, and we're going to just make sure we don't hear any abnormal sounds. First, I'm going to listen to your aortic valve at the second intercostal space, right sternal border. Okay. And now I'm going to move over to your pulmonic valve, also the second intercostal space, left sternal border. Okay. And then move down to the third intercostal space, also left sternal border, for Erb's point. And then I'm going to move down to your tricuspid valve, fourth intercostal space, over here. Okay. Perfect. And then I'm going to move down to your fifth intercostal space, the apical, where S1 is noted the loudest, but we're also going to be assessing your mitral valve. Okay, perfect. I did not hear any abnormal sounds, but I'm going to go back and listen with the bell side of my stethoscope for any other different kinds of sounds. Okay? Okay. So back at the aortic valve, pulmonic valve, Erb's point, tricuspid valve, and then your mitral valve. Okay, no abnormal sounds noted. Your heart rate looks good. It was 62. No murmurs noted. I'm just going to be checking your pulses now. Okay. Refill. Check your feet. Extremities are equal. Are pink, warm, well perfused. Your pulses are, peripheral pulses are equal and regular. No abnormalities noted. No mass palpated. Okay, and now we're going to move on to your neurological part of the assessment. So we're going to be testing some reflexes and your walking and your talking, which is all intact, but we're just going to do a little further of an assessment. Okay, so I'm just going to use an instrument to test your reflexes. And first, I'm going to be checking your bicep reflexes. So we're just going to have you loosen your arm. Perfect. I'm going to be checking the bicep reflex. Okay. And now on the same arm, we're going to be checking the tricep reflex. Okay. And you have reflex. And then I'm going to do the same here. Okay. And now back to the tricep reflex. Perfect. Okay. And now I'm going to be checking your patellar reflex. Okay, and then this one. Perfect. And your Achilles. Posterior. Okay. Okay. Reflexes are +2 and normal active throughout. Can you shrug your shoulders for me? Perfect. And can you hold your arms out? And can you push against them? Perfect. Strength is equal bilaterally with resistance. Squeeze your hands. Perfect. Strength is equal bilaterally and strong. And now I'm going to have you stand up. Okay. And I'm going to have you put your hands and feet together. Perfect. And I would like you to hold your hands out. And we're going to have you close your eyes. And we're performing the Romberg's test right now. And you're just going to keep them like that and have your eyes closed and let me know if you feel any dizziness. Okay, no swaying or dizziness noted. Romberg's test is negative. Okay. And now if I could have you turn and walk 5 steps this way to assess your gait. Okay. Your gait is strong and steady. And if you could just walk back. Perfect. That's good. And then if you'll have a seat again. Okay. Actually, sorry. One more time, stand up. We're just gonna inspect your spine. If you could turn this way. Perfect. Stand like here. Just gonna lift your shirt. Is that okay? Okay. Okay. No abnormalities or masses noted. Okay. I'm just going to be inspecting the chest too. Okay. And if you can just bend down and touch your toes. Perfect. Awesome. Okay. The spine is symmetrical and even. If you can have a seat again. Computer. Oh. Okay. I think the computer went out. Oh, no it didn't. Okay. And now we're just going to move on to chest. I'm going to incorporate some more things into your chest assessment as well as your abdomen, and then we'll be just about done, okay?
Okay.
So if you want to get comfortable and lay down. Perfect. Okay. I'm just going to be lifting your shirt up a little. Okay. And now I'm going to be listening and palpating at the same time. I'm just going to listen to your bowel sounds right now. Okay. In all 4 quadrants of your abdomen. Okay. It's a cold side. Perfect. Okay. I just have to listen until I hear some. Okay. Great. And now I'm just going to do some light palpation and percussing. I'm going to percuss first, okay? I'm just going to percuss over the right upper quadrant. Perfect. Dullness noted. Now I'm going to be percussing on the left upper quadrant. Dullness also noted. Now I'm going to move down to your lower quadrant on the right side. Okay. Tympany noted. The left lower quadrant, tympany is also noted. Now I'm just going to do some palpation. Is that okay? Okay. So I'm going to lightly palpate first, the right upper quadrant. Okay. Left upper quadrant. Okay. Now the right lower, left lower. No masses noted. Skin is pink and smooth. No striae noted or any scars or lesions. Now I'm just going to do a little deeper palpation, and I'm going to be seeing if we can palpate any of your internal organs. Okay? So the right upper quadrant, palpation. The liver is non-palpable. And the left upper quadrant, the spleen is now non-palpable. Your right lower quadrant, your right kidney is non-palpable, and in your left lower quadrant, the left kidney is also now non-palpable. Perfect. Now you can lift up your shirt, and we're just going to listen to your lung sounds. You can sit up, yes. Perfect. Okay, I'm going to inspect your chest here. Perfect. The AV ratio is greater than the transverse ratio, which is normal. And like I said before, the chest is symmetrical bilaterally. Can you just take a deep breath? Okay. And one more. Okay. Chest rises equal bilaterally. Now I'm just going to listen to your breath sounds. Perfect. Okay, I'm just going to take some deep breaths. Perfect. Okay. Great job. and equal clear lung sounds noted throughout. No adventitious sounds noted. Your rate is normal and even. No shortness of breath or anything like that. Okay, I think that is about it. You did really well. Do you have any questions for me? Any concerns? No? Okay. Perfect. Well, thank you so much for allowing me to do my assessment on you.
Thanks.
Thank you. Have a good day.
You too.